Daycare surgery, also known as ambulatory surgery or same-day surgery, refers to procedures where patients are admitted, undergo surgery, and are discharged on the same day without an overnight hospital stay. Proper selection of patients and procedures is crucial to ensure safety and effectiveness. Here are the detailed selection criteria. Hash 1. Patient-related criteria. These focus on the patient's general health, age, and ability to tolerate and recover from surgery. A. General Health, ASA classification, American Society of Anesthesiologists classification, ASI, healthy individuals. ASA 2, patients with mild, well-controlled systemic diseases, e.g. controlled hypertension or diabetes. Exclusions, patients with severe systemic diseases, ASA 3 and above, uncontrolled medical conditions, or significant risk of complications. B. Age, generally suitable for patients between 2 to 70 years of age. Older adults and young children may require additional evaluation based on comorbidities and recovery potential. C. Comorbidities. Patients with stable and controlled comorbidities, such as diabetes, hypertension, or asthma, may qualify. Exclusions. Uncontrolled or unstable medical conditions. Severe cardiac, respiratory, or renal dysfunction. D. Social and psychological factors. A reliable support system at home, e.g. family or caregivers to assist during recovery. Access to transportation for safe return home and follow-up visits. Understanding and willingness to comply with post-operative instructions. E. Nutritional status. Patients should not be malnourished or obese. Extreme obesity can complicate anesthesia and surgery. F. Allergies and anesthetic risks. Patients with no known allergies to anesthesia or local anesthetics. Patients who are not at high risk of anesthesia-related complications, such as severe sleep apnea. 2. Procedure-related criteria. These focus on the type, complexity, and expected duration of the surgical procedure. A. Type of procedure. Commonly performed procedures include minor ENT surgeries, e.g. tonsillectomy, sinus surgery, orthopedic procedures, e.g. arthroscopy, carpal tunnel release, general surgeries, e.g. hernia repair, laparoscopic cholecystectomy, gynecological surgeries, e.g. hysteroscopy, dilation, and curettage, urological procedures, e.g. cystoscopy, circumcision. B. Complexity. The procedure should be relatively simple and low risk, involve minimal blood loss, not require extensive postoperative monitoring. C. Duration. Typically under 2 hours of operative time. Prolonged surgeries, 2 hours, may increase the risk of complications, making them unsuitable for daycare. D. Recovery and pain management. The procedure should allow rapid recovery from anesthesia. Pain should be manageable with oral medications post-surgery. 3. Anesthesia-related criteria. Patients should tolerate general anesthesia, regional anesthesia, or local anesthesia with minimal risk. Quick recovery from anesthesia is essential. No history of severe post-operative nausea and vomiting, PONV, or other anesthesia-related complications. 4. Facility and resource-related criteria. The healthcare facility must ensure availability of trained staff and necessary equipment for daycare procedures, proper preoperative assessment facilities, rapid access to emergency services if required, clear communication about follow-up care and instructions. 5. Geographic and logistic factors. Patients living within a reasonable distance from the surgical facility. Proximity to emergency care in case of complications. 6. Contraindications for daycare surgery. Medical contraindications: unstable cardiac, pulmonary, or renal conditions, severe obesity, BMI 40, or obstructive sleep apnea, bleeding disorders or anticoagulant use requiring reversal. Social contraindications: no caregiver support at home, inadequate transportation. Procedure-related contraindications: high risk or complex surgeries requiring prolonged monitoring. By carefully adhering to these criteria, daycare surgery can be performed safely, reducing healthcare costs and improving patient satisfaction.